Thank you very much, Mr. President. Mr. President, we are on the verge of the one-year mark since the United States Senate attempted to take away health care from 30 million Americans and was told no by the American public. For virtually the entire time since the passage of the Affordable Care Act, Republicans in the House and the Senate engaged in an exercise that was futile while President Obama was in office, but then was made possible by the election of Donald Trump. That was the repeal of the Affordable Care Act, which extended care to 20 million Americans who didn't have it, guaranteed that health insurance would actually cover the things you need, and protected people who were sick or people with pre-existing conditions from discrimination. When Republicans finally took over, they realized that they had spent a whole lot of time criticizing the Affordable Care Act, but not a lot of time figuring out what would come next. And most of 2017 was spent in an embarrassing series of proposals that, according to the Congressional Budget Office, would uninsure somewhere in the neighborhood of 20 to 30 million people. Finally, when a vote was called on the floor of the Senate, just enough Republican senators chose to side with the American people who want to maintain the protections of the Affordable Care Act and work to perfect it, that the bill failed by one vote. That one-year mark will occur this weekend on Saturday. And so a few of us wanted to come to the floor today to talk about what's happened since that fateful vote a year ago that was frankly celebrated all across this country as folks who were deeply fearful that their health care was going to be ripped away from them by the United States Congress realized that they might be able to rely on it for at least another year. But let me set the stage first by reminding people the promises that were made. This is President Trump shortly after his election, just before his swearing in. He said, "We're going to have insurance for everybody. People covered under the law can expect to have great health care, much less expensive, and much better." Now, that's a clear promise that the president made. Everybody's going to have insurance. It's going to be less expensive, and it's going to be better. More insurance, less expensive, better quality. The vote that took place a year ago this Saturday would have done exactly the opposite. It would have kicked 30 million people off of insurance. It would have driven up costs for millions of Americans, especially those people with pre-existing conditions, and coverage would have been much worse, not much better, in part because people with pre-existing conditions wouldn't be able to access care. And so this promise never came true because of the vote that we took a year ago this Saturday. But occasionally, the president does say something that's true. This is a picture of the celebration that the House of Representatives had at the White House the day that they voted on a proposal that would rip away health care from 30 million Americans before the vote that took place here in the Senate. A lot of smiling faces of members of Congress who were so excited that people who had cancer or people who had diabetes would be unable to get health care insurance. This quote is not actually from this press conference. It's from a rally that the president held just a few weeks ago. He was talking about the fact that John McCain and some others voted against that proposal on the Senate floor that caused it to fail. But he said, this is the president's words, "It's all right, because we've essentially gutted it, the Affordable Care Act, anyway. It's all right because we've essentially gutted it anyway." So that summarizes what's happened since the failed vote on the floor of the Senate a year ago. President Trump and his Republican friends in Congress, all smiling behind him, have gutted the Affordable Care Act, not because they want better health care for people, but because they're just angry that they couldn't get the votes to do it here in Congress, and so they're doing it another means. And so a few of us are going to be down on the floor to talk about what has happened in that last year. Now, I actually think that most of my colleagues do want better health care for their constituents, but I don't understand how any of what has happened, either through legislative act or through administrative action, gets us there, gets us to that promise that President Trump made in January of 2017. Because here's what's gone on. First, the president sent an executive order saying that all of his agencies should start to take their own actions to unwind the protections of the Affordable Care Act. Then he stopped the marketing for the Affordable Care Act so that less people would know about the options that were available to them. Then the president came to Congress and worked with Republicans to take away one of the most important pillars of the Affordable Care Act, the requirement that healthy people buy insurance. That action alone will result in 13 million people losing insurance and rates going up for 10 million Americans. Most recently, the president authorized the sale of junk insurance plans all across this country, plans that don't have to cover mental health or prescription drugs or maternity care. He then cut funding even deeper for the personnel that help you find what insurance is right for you, and he instructed the people that remain to push Americans onto the junk plans. Then the president sent his lawyers to court to argue that Congress actually can't protect people with pre-existing conditions because it's unconstitutional, which would wipe out all the protections that people enjoy today. And so it's really no mystery as to why, as the 2019 premium increases are coming out, they're catastrophic. They're catastrophic. 14 states have insurance companies that have requested premium increases of 10 to 20%. Connecticut is one of those. 5 states have insurance companies that have requested premium increases of 30% or more. And think about that for a second, 30% or more. Who can afford a 30% or a 40% increase in premiums? One insurance company requested a 94% increase in rates. And in 21 of the states that have had rates filed already, the insurers said the reason they are doing this, the reason they are passing along enormous premium increases is because of the sabotage campaign that's being run by the president and by this Congress. Most of it occurring since the failure of the repeal vote a year ago. It's all right, says the president. We didn't need to repeal the Affordable Care Act. That vote that we're marking the 1-year anniversary of doesn't really matter because we've essentially gutted it, the Affordable Care Act, the American healthcare system, anyway. And so finally, before I turn this over to the ranking member on the Health Committee, I just want to talk about the next phase of the sabotage campaign. If Republicans in Congress can't get the American people to support a legislative act to repeal the Affordable Care Act, the next hope is for the courts to do it. And so that's why the nomination of Brett Kavanaugh is so critical to this continued campaign of trying to undermine the Affordable Care Act. Because you probably can't get the majority of members of Congress to wipe away protections for people with pre-existing conditions, but maybe you can get the Supreme Court to do it. There's a case that I just referenced that the Trump administration is supporting, moving its way through the courts, that would invalidate, constitutionally invalidate, Congress's protections for people with pre-existing conditions. These are people with cancer, diabetes, heart disease, mental illness, cerebral palsy, Crohn's disease, ALS, addiction, lupus, epilepsy, Parkinson's, the list goes on. And President Trump made clear during the campaign that he wasn't going to pick a judge in the mold of John Roberts who would uphold the Affordable Care Act. He was going to pick judges that would rule with him to strike down the Affordable Care Act. That's also probably why he outsourced the decision on who to pick for this vacant slot to political groups like the Heritage Foundation. And so the expectation is that Brett Kavanaugh will deliver one of those 5 needed votes to strike down the laws on the books that Congress can't find the votes to override protecting people with pre-existing conditions. The Supreme Court could take away your health care if you have a history of any of these diseases. And if that happens, The results are lethal. If you have metastatic cancer and you don't have the protection in the law that says insurance companies can't charge you more because you're sick, a recent study shows that you will be charged a rate $142,000 higher than what you pay today. If you're an individual with diabetes, your increase could be 137% on top of what you're paying now. So these are the stakes. These are the stakes as we prepare to vote on Judge Kavanaugh's nomination. And it is all in service of this very intentional, very deliberate, very planful campaign of sabotage. A year ago this Saturday, the American people got their way, and this body decided not to repeal the Affordable Care Act because people like the fact that 20 million people have insurance. People like the fact that people with pre-existing conditions are protected. That night, the American people got their way, but since then, the President and this Congress have been working to undermine it. And the next step in that plan is the elevation of Brett Kavanaugh to the Supreme Court. And it's important for us to come down to the floor and explain what the stakes are. Thank you, Mr. President. I yield the floor.